Hello, I'm Alex Bottle from Imperial College London, and I'd like to tell you about our work on health service and social care use by heart failure patients living in a community in northwest London. This is work we've done with my colleagues Danny Kim, who did the analysis, and Benedict Hayhoe, Paul Aylin, and Martin Cowie. And it's the first work that's come out of our new database in northwest London, which I'll tell you all about. Now, this it's a bit weird doing this recording in my spare bedroom, but hopefully you'll enjoy it all the same. Heart failure is really important. It's not very sexy. You won't hear celebrities talk about it, but it's common. At least 500,000 people have it in the UK. It's chronic. It's expensive to treat. It's high mortality and morbidity. And comorbidity is very common. Most of the readmissions and admissions in patients with heart failure are for other causes. It's an ambulatory care sensitive condition, so there's an important role in all sectors of health and social care. So what do we hope to achieve by using our whole system integrated care database? We want to look at an in-depth exploration of health and other service use by patients with heart failure. And we want to improve risk stratification over what's been done with another database, Clinical Practice Research DataLink. So we've previously shown with that database low adherence to NICE guidelines for diagnosing heart failure in primary care and for specialist follow-up following hospital admission. So can we understand more about who needs what level of support in order to improve outcomes? So I'm going to tell you about the first question. The WSIC database has a number of similarities, but also some differences between that of CPRD, another very commonly used linked primary and secondary care data. So they both are de-identified electronic health records. They both involve linkage of primary care and secondary care, and they're also linked to other data sets. But WSIC in northwest London also has these other bits, the community care, mental health and social care records that CPRD doesn't have. CPRD covers a broader population because it's about 10% of the UK population, whereas WSIC is just in northwest London, but does cover all 360 or so practices there. It covers different IT systems. The quality checks to some extent are different. CPRD is long established and has its own data quality criteria. WSIC is still catching up a little bit here. But another nice feature of WSIC is that it shows the actual name of the GP practice or the NHS or other organisation, which CPRD doesn't do. That's really convenient for researchers. So in this particular work, looking at heart failure, we identified a cohort of heart failure patients at the start of our study period, January 2015. We then described their yearly health service use between 2015 and 2018. And we identified patterns of service usage using K-means cluster analysis, where we had 9 health and social care utilization variables for clustering. Health service use was pretty common in these patients. So 70% of them used outpatient services, 60% saw GP, about 40% went to A&E, about 40% used community services, etc. And the cluster analysis showed 5 distinct patterns of health and social care use. So along the bottom, you've got our 9 different kinds of social care use: emergency admission, elective admission, unplanned A&E visit, outpatient cardiology visit, outpatient visit for some other specialty, a GP consultation, community contact, mental health service contact, and social care contact. And we've got red and blue kind of heat map here to show you the difference between the average population on a given cluster for each of these 9 elements. So for instance, cluster 1 is all blue. So compare with the average heart failure patient, this set of patients used less of everything. Whereas at the top, you've got cluster 5, they used more of pretty much everything, but they are blue for this outpatient cardiology visit. They're particularly red for the community and social care. Whereas this one, cluster 4, they were high users of outpatient cardiology visits, much less of everything else. So there are quite distinct patterns of health and social care use here, which we've described. So who were kinds of patients using those different kinds of, with those different patterns of service use? As I said earlier, heart failure patients are very heterogeneous in their characteristics, in their presentations, in the prognosis of their condition. So it shouldn't surprise you to learn that they use these different kinds of services in different ways. Heart failure patients made heavy use of pretty much everything, but very varied use. So clusters 1 and 2, these were patients who were younger, female, with less comorbidity on average than the others, and not living in care homes. These were generally low users of healthcare. Those with higher blood pressure and more comorbidities had relatively more GP consultations than the average, but were still low users of all the other kinds of services that I listed. That's cluster 2. Clusters 3, 4, and 5 were patients who were older, male, and with more comorbidities, and these folk were generally higher uses of healthcare than the average heart failure patient. Curiously, the lowest users of GP appointments were very high users of everything else, thus cluster 3. As expected, those with the most cardiovascular comorbidity, cluster 4, had the highest usage of cardiology-related outpatient services and referrals to an echo. Lastly, cluster 5, the oldest patients with the highest mortality were the highest users of emergency admissions, A&E visits, and the other services, other meaning mental health, community, and social care. So very different patterns of use here. That's it. That's a very rapid summary of our work using the WSIC database in North West London. If you've got any comments or questions, just drop us a line. You can also contact me directly. I'm Alex, and this is my Imperial address. I'm on Twitter, LinkedIn, etc. And if you want to know more about the WSIC database, which is now called Discover Now, which is an HDR UK hub in North West London, here is the link for that. And thanks for listening.